Health Secretary, thank you very much for joining us. Now, obviously we should start by talking about the NHS test and trace system that launched today. It's incredibly ambitious. You're hoping to do 200,000 tests a day. The turnaround for those tests are 24 hours. Then you're going to contact trace 10,000 people a day. There are concerns that the system just isn't ready.
Oh, well, it has been a huge job building this system in a matter of weeks. And Baroness Dido Harding, who's done that, has done an absolutely brilliant job. You know, we brought together almost 50,000 people to make this happen. And what really matters is that everybody in the public, all those who are contacted by NHS Test and Trace, engage with it and follow the instructions that they give, because this is about having a more targeted approach to lockdown and to tackling coronavirus than the blanket approach that we've had to take until now. So if you're called by NHS Test and Trace and asked to self-isolate because you're at higher risk, because you've been in contact with somebody who's tested positive, then please do so.
So you're confident that this system can hit the ground running today?
I am. Of course, there'll be bumps in the road. That's inevitable when a big new system like this comes in. And, you know, you set out just what a scale we've built over the past few weeks. And so, even if there's a few wrinkles there, I think that the goal is constantly to learn from that and constantly to improve the system.
Now, as you said earlier, if you're contacted by the NHS and told that you've been in contact with someone that has the virus, you have to quarantine for 14 days. If we have the testing capacity, why aren't we testing all of those close contacts instead of making them quarantine for 14 days? Because we could have the situation where someone has had the virus, then they are told to repeatedly quarantine because they keep coming in contact with people that then have the virus. They're unlikely to show symptoms, so they're never going to get tested. Isn't this just a huge waste of time and money?
So these are really important questions, and ones that I've asked my clinician advisors all the way through this. And if I can try to answer each one of them, the first thing is that sadly, we are not confident that people like me who've had the disease are at a low risk of transmitting again. We're working on the science. We're trying to find an answer to that question, because obviously for those, and there's millions of people we think who have had it, it would be far better if we were confident that we not only wouldn't get it again and be at risk ourselves, but also wouldn't transmit it, which is the critical thing for controlling the virus. The next question that you asked is about people getting tested when they have been asked to isolate. And again, we've looked at this. The problem is that because this virus can incubate for up to 14 days before the symptoms show, that means that you could test, the test come through negative, you release the person from the isolation, and then they are the symptoms then come through because they were positive. It's just that the virus was incubating and hadn't expressed itself in symptoms yet, hadn't caused symptoms yet. So unfortunately, testing will not prove that you don't have the virus, and so because of that risk of what's called false negatives, we aren't able to do that. So the message to the public is, if you are asked to self-isolate by the NHS test and trace system, then please do so.
But essentially we could have those false negatives for the first test, but I'll move on. Yesterday we heard Boris Johnson say that people who refuse to quarantine for 14 days may face financial sanctions. What about those that just can't afford the financial sanctions, like the self-employed?
So if I just clear up a point that you made at the start of that question, the false negatives is a problem, meaning that it doesn't help us to test people when they're in isolation. The positive test, of course, comes through from somebody who does have the disease, and that's really, really important, that when you do get symptoms, you isolate immediately and get yourself tested. And then if somebody tests positive, that's the moment at which we get in contact with their contacts and tell them that they need to isolate. On the point that you made about financial support, absolutely. We put in place financial support right at the start of the crisis several months ago. There's guidance that we published to employers because employers should treat you, if you're asked to self-isolate, employers should treat you as if you are sick, because you're being told to go home for health reasons. And it's not only for your own health, because you've been at risk of catching the disease, it's also because of the health of others and protecting the health of others.
But of course, a lot of employers are also struggling at the moment. Now, the key to this test and trace system is the public buying into it. We need the public to get involved. Isn't this going to be a tough ask, considering that senior government advisors didn't stay at home when displaying symptoms?
No, because I think it's strongly in everybody's interest that whoever's called by the NHS test and trace advisors does as they are asked. It's not a matter of doing it for the government's sake. It's doing it for your loved ones and your community and ultimately the country. That's why I've described it as somebody's civic duty to follow these rules. Now, we could, as the Prime Minister said, we could bring in mandation. I have the legal powers to bring that in, but we think that it's better done voluntarily, and we think that the degree of compliance will be very, very high.
Just going back to what I slightly mentioned earlier, are you finding it a little humiliating to have to repeatedly defend somebody that most people think broke the lockdown rules?
No, I'm just totally focused on making sure that people know the new system we're bringing in. Because if you think about it, we haven't brought in a new, tighter part of lockdown for several weeks now. In March, we kept tightening the lockdown, and we're bringing in a new type of lockdown, more focused on individuals rather than the population as a whole, according to those who are higher risk. And I'm just totally focused on getting the message across that if you get that call from the NHS test and trace system, it's really important that you follow the instructions.
OK, moving on to something slightly different. We might see the last clap for carers tonight, this evening. It'll be the 10th one, and it may be our last. We commissioned a poll that found that 75% of us would back a pay rise for NHS staff. Could you commit to that?
Well, there is absolutely an agreed pay rise that happened in April, in the midst of this crisis, that is happening next April for NHS staff. And I think that Clap for Carers has been brilliant. I think one of the positive things out of this crisis is that people have shown their appreciation, their love for the NHS, and their huge gratitude to carers in social care, informal carers, and of course the NHS. And I think that's been one of the really positive things out of it. And, you know, there have been many, many negative things out of this crisis, but that's one of the really positive things. And especially those who work in social care, you know, it's so important, social care. And sometimes people in social care have not felt as appreciated as those in the NHS. And sometimes people in the NHS haven't felt the appreciation that I know that we all feel for what they do.
Well, that's a lovely note to end on there. Health Secretary Matt Hancock, thank you very much for your time.
Good to talk.